Hello, my name is Todd Bailey. I want to talk to you today about DMSO. It's a natural healer. DMSO is an acronym for dimethyl sulfoxide. Dimethyl sulfoxide is a naturally occurring substance. It comes from trees. It comes from the pulping process for trees. And it is a sulfur compound that has some amazing healing properties. You really need to know about this. It ought to be part of your own natural first aid kit, your natural healing kit. The properties are remarkable. DMSO itself is an anti-inflammatory. It'll actually reduce inflammation. It's nature's strongest anti-inflammatory. It can be taken internally with a doctor's help, or you can simply put it on topically, like with some of the formulations that we make. The topical DMSO gets absorbed really well and helps tamp down and control inflammation. Now it goes a step further. It will also reduce free radicals. Those are damaged molecules that come from oxidative stress or other bodily functions. They are not good to have in your system. Those free radicals will damage other tissue, trigger inflammation and other problems you just don't want to have. We want those out of our system. Fortunately, DMSO will bind with those free radicals and carry them out of your system, which is awesome. Also, you get increased, that's not much of an arrow, but you get increased cell wall permeability. That means the cell walls are able to pass things back and forth through the cell wall more easily. If there's waste inside of the cell that's trapped, you're going to have an unhealthy cell, you'll have poor cell function. DMSO will help the cell release that waste and get it out of the cell, get the crap out. It'll also let good things get in. DMSO can get in and other things combined with DMSO because of that increase in permeability, that ability to pass through the cell wall itself. Additionally, you're increasing the transdermal properties of your skin. DMSO is able to penetrate your skin very readily. DMSO is kind of interesting. It plays really well with water, but it also plays really well with oils or fats, and that's pretty unusual to have a substance that can handle both water and fat. But DMSO does that very handily. That's one of the reasons it passes through your skin and gets into your skin and then down deeper into your other tissue, muscles, joints, and so forth. That transdermal effect lets the DMSO get on through and start working to reduce inflammation, clean up the free radicals, and also act as a carrier. It increases the ability to get things into your system. There are some substances which are just awesome, like CBD. It's really awesome for your system, for overall homeostasis, for controlling pain, stress, all sorts of things. But topically, it's not well absorbed. Orally, it's effective, but much of the oral CBD is destroyed through the stomach acids. So topically is a great way to go with CBD, but it doesn't absorb well. Combine it with DMSO, and it's going to get absorbed really well. By the way, DMSO will help all sorts of things get absorbed. So we make sure that we clean the area that we're going to apply the DMSO to. For instance, if I'm working on my elbow and I want to put DMSO or one of our DMSO creams on that elbow, I'm going to wash it really well first. If I've just wrapped up a workout and I'm all sweaty, I'm going to wash that elbow. Same thing. Because when we sweat, the body is eliminating wastes and toxins through sweating, getting pushed out through the skin. I don't want to work up a really good sweat and then slap on DMSO and push those toxins back in again. No, I want them out. I want them gone. So I'm first going to wash the area, then I'll apply the DMSO. That works really well. Next, I don't know if this arrow should go up or down, but this is a natural NSAID. I'm going to say down because we're reducing pain. NSAIDs are non-steroidal anti-inflammatory drugs, like aspirin, for instance. But aspirin, even though it was a wonder drug at one point, still has some pretty good uses. It's hard on your system. If you take too much aspirin, it starts to work over your stomach. It'll work over your lower GI tract, and it can make quite a mess. DMSO is a natural NSAID. It does all the same things that aspirin will do as far as pain, but It does not affect your GI tract. You're not going to get the stomach bleeds. You're not going to get the intestinal tract bleeds like you do with aspirin. So use DMSO instead, topically. Also, this is awesome. DMSO increases the diameter. It allows blood vessels to expand and stay expanded. It's a vasodilator. When you dilate something like a blood vessel, it means you're opening it up wider. You're making it the distance across bigger. So with a vasodilator, we're opening up the blood vessels. We're getting more blood where we need it. And with that blood comes nutrients and oxygen. Also, the blood helps get rid of some of the waste. So it's grabbing things, taking them out, filtering all that through kidneys, liver, whatever. The vasodilation is critical if we want to get faster healing, if we want to get some of the chemicals that cause inflammations like cytokines. If we want to get those removed from that sprained ankle, vasodilation gets us a bigger pathway, and we pull the cytokines and other unfortunate chemicals out, the ones that cause the swelling, the pain, the redness, and the slower healing. So the vasodilation is really important. Next, we're going to go down with this. This is an analgesic, meaning DMSO will reduce pain. It will interact with nerve cells and nerve fibers and reduce their ability to send signaling, much like when you get a topical lidocaine. That will reduce the nerve's ability to send signals, so you get a little bit of numbing, and DMSO will do the same. So it's pretty awesome. And it's got a lot of benefits, a lot of uses. Now, as far as uses, arthritis is way up on the list because with arthritis, you get degeneration of joints, degeneration of tissues, lots of pain, inflammation, swelling, whether it is from natural wear and tear or an autoimmune issue. You can get some relief, a ton of relief, by attacking the arthritis with DMSO and treating with DMSO to reduce that inflammation and allow the body to heal as much as possible. Next is joint pain. Unfortunately, I'm a bit of an expert in joint pain, having had 20 joint surgeries. I really depend on the DMSO. I use it several times a day, before my workout in the morning, after my workout in the morning, and then at least once at night, and sometimes during the day, depending on whether I'm having something flare up. The DMSO is absorbed really well into the joint, and it takes a lot of other things into the joint with it to help cool the inflammation, cool the swelling, and help my knees, shoulders, back to be able to function better. DMSO is also great with muscle pain. It is a muscle relaxant, also analgesic, so it helps to take down the pain, and it will also take care of inflammation, muscle tears, and other muscle injuries. It'll help that healing process get started much more quickly. As far as back pain, the back is interesting. Sometimes we talk about the back as though it's a joint, a single joint, and instead it's a couple dozen joints. When we're talking about back pain, we're talking about all the different spaces between the vertebrae where we have all the action and all the movement. Those are all subject to wear and tear and pain and inflammation. DMSO will help to cool that inflammation, help us to maintain the flexibility that we would like, the function that we would like, so that we can be like my dad, who's in his 80s, still golfing. And that's pretty awesome. Next, nerve pain. Nerve pain pops up in a lot of different ways. Nerve pain can be a function of the inflammation and injury to a joint, for instance. But it can also be just plain old nerve pain, like with fibromyalgia. With fibromyalgia, you get flare-ups of nerve pain, even though you can't say, I sprained that ankle or I did something to that knee. We can get flare-ups that are just the nervous system in overdrive. DMSO will help settle the nerves. We get a lot of relief with one of our products that we've designed just for fibromyalgia. Besides DMSO, we have some other things that we include that help settle the nervous system, settle the surrounding tissue, so we can get some relief, especially for that, because fibromyalgia is such a bugger to treat. We can also get relief with soft tissue, the scarring of tissue. I have had 13 knee surgeries. My left knee in particular is kind of interesting because we did some experimental things a couple decades ago. And now I've got some pretty groovy scar tracks. In fact, when I had my knee replacement a decade ago for that knee, we had to use the same scar track that had been used several times before, and it's big. And it had been cut so often that the doctor wasn't sure it would heal, so he had these big old 4-pronged clamps, staples. I had 38 of those to hold things together. So I've got some pretty nasty scarring, which is not good for a joint. Now, if it's just superficial surface scarring, that's not so bad. It's not awesome, but at least it's not going to interfere with the joint function. Once you invade the joint capsule, which you typically have with a shoulder surgery, knee surgery, even a back surgery, then you get scarring that can bind up the joint. You can develop adhesions, you can develop some gumminess or stickiness with the fascia. And the DMSO will help soften all of those scar connections, the extra tissue that is being laid down by the body to try to help, but it actually turns out to be a bit of a hindrance. If you've got adhesions and scarring and fascia issues, your joints can become pretty creaky, pretty tight, pretty hard to bend when you need to get them to bend. The DMSO will help soften that scar tissue so you can maintain the flexibility. Without flexibility, it's a bit tough to maintain a good quality of life. Finally, or actually the last two things I put on, interstitial cystitis. This one is pretty nettlesome. This is like a bladder infection without an infection. It is not based on a bacteria like you would have with a lot of bladder infections. It's more of an inflammatory response that can be settled with DMSO. And interestingly, the FDA has an approved process for that. Also interestingly, if you look at FDA materials, sometimes they sort of talk out of both sides of their mouths. They'll kind of denigrate DMSO, but at the same time, use DMSO extensively. Among other things, besides interstitial cystitis, it's used for its cryoprotective properties. If somebody needs a heart transplant, it's going to be taken from one person, the heart's going to be stored or transported to be put into another person, and it's got to be kept super cold during the process. If that heart is placed on ice to bring the temperature down, then ice crystals can form in the tissue and can damage that heart and maybe even make it unusable. Instead, the ice and water are combined with DMSO. This is where it gets kind of funny. Well, strange. Water has a freezing point of 32 degrees Fahrenheit. DMSO's freezing point is about 65 degrees Fahrenheit, so much higher. But if you put the two together, the freezing point drops well below the freezing point of water, just the way that they interact. And that means that that heart can be taken to a much lower temperature without the crystals forming like you would have with ice if you were using just water. So it's cryoprotective. That DMSO allows for a much lower temperature to protect that tissue. It works the same way on stem cells. Sometimes they need to be taken, harvested from one person, transferred to another, and the DMSO allows for cooler temperatures to preserve that tissue. So it's a really interesting compound. Now, DMSO can also be looked at as a carrier. This gets pretty interesting. As a carrier, DMSO can help get a substance through the skin to where we want it to go. The skin itself, sometimes we think of as a barrier. It's actually kind of a carrier. And DMSO just enhances that ability. DMSO itself will absorb really well through the skin. And if it's combined with other things like essential oils, those items, those things are also going to go in through the skin. So we can combine DMSO with other things that we want to get into that tissue to help with inflammation or pain or other damage. And there are some things that are just amazing. Frankincense, for instance, has its own amazing properties as far as helping with pain, inflammation, healing, mood, and it's just amazing. We use frankincense, typically 3 different types in each of our formulations. So we call it frankincense, but in fact, it's at least 3 different strains out of the potential 10 or 12. DMSO will take that frankincense deeper into the tissue so that it can help with the inflammation and other things. Also, wintergreen. Now, I put these 2 at the top of the list because they're kind of special to me. When I had my knee replacements 10 years ago, the age of 50. I had one replacement in January, a back surgery in April, and the knee replacement in December. That was quite a year. But I got my first knee replacement in January. The doc sent me home from the hospital with 3 opioids to take just to control the pain. Because with full knee replacements, they cut off part of your tibia. They cut off part of your femur, and often they'll cut off part of your kneecap. So there's a lot of damage, plus they're invading that joint capsule. It's a pretty big surgery. Typically, scars run 4 or 5 inches long. My left knee, the one that had the experimental surgery, this scar for the knee replacement is about 12, 13 inches long. So pretty involved. Anyway, the doctor sent me home with opioids. 3 different opioids, all different colors, very pretty, and they worked. But they only worked for about an hour. I was supposed to take them all at the same time, which I did, and then I would get relief for about an hour. So I could sleep for about an hour. And then things got kind of rough because I couldn't take those opioids again for another 4 or 5 hours. Well, that didn't work so well. 1 hour of sleep, 5 hours off. 1 hour of sleep, 5 hours off. That's just miserable. My wife intervened. She is big into essential oils and other natural healing and wellness. She put together a cream that had a few essential oils. She would put that on and then layer on frankincense and wintergreen, both of which are really awesome for pain. Wintergreen itself is just outstanding. With that, I was able to get 3 or 4 hours of relief. I got far more relief with that combination than I got with the opioids. So there's some powerful natural healing, natural medicine in those oils and the other substances that we can include with DMSO. Next on the list is CBD. CBD is pretty awesome for just overall homeostasis. There's an entire system of the body called the endocannabinoid system. And if you see an illustration of it, it looks kind of like the nervous system. It runs all the way through the body, the brain, the fingers, arms, legs, feet, and it's extensive. And among other things, it helps with overall body homeostasis. That's just making sure everything's functioning well, and we have that sense of groundedness, the chill that we're looking for. But CBD goes beyond that. It also helps with mood, and it does a lot for inflammation and pain. We want to use CBD to help with inflammation and pain. Unfortunately, if I rub CBD on, it doesn't absorb that well. But if I put it in the DMSO solution, it absorbs really well. And I can get that effect of the CBD into my system, into the joint, the tissue, the nerves that I want to affect. So we love having CBD in the products. Next, I've got hyaluronic acid. Hyaluronic acid, you'll see if you go to the store and you're looking for a face cream, just a moisturizer, you might see hyaluronic acid. It is wonderful for helping with skin health and skin moisture. But it does more, especially if you get the right type of hyaluronic acid. Hyaluronic acid helps lubricate our joints. It helps with soft tissue, connecting the connective tissue like the ligaments and tendons to stay healthy and vibrant and nice and flexible, pliable. But you have to use the right size of hyaluronic acid. Hyaluronic acid has a large molecule potential, then a medium-sized molecule, and then a small molecule. The small molecule can penetrate further into the tissue, further into the joint. When we're talking about that smaller molecule, we talk about a low molecular weight. Smaller molecule that can be driven further into the system, into the joint. Typically, we'll use 2 weights of hyaluronic acid. We want to get down through the skin to the first layer of tissue below, and then we want to push further down into the joint. So we use a hyaluronic acid. If I put it on my face, which I actually do with one of our products, I get great moisturizing, all the effects of the hyaluronic acid, plus deeper penetration. See, lavender. Lavender is awesome for settling muscles, especially muscles in spasm, and for settling nerves that are just amped up too much, like you would get with fibromyalgia. And we can combine other things. I'm just picking a few that I like off the list. Next, I've got magnesium. Magnesium is a mineral that is crucial for muscle and nerve function. Unfortunately, most adults are deficient in magnesium. Part of it's our diet, part of it's where the food comes from, depleted land, and so forth. We need more magnesium, and we need the magnesium in our muscles, at the nerves, so we include magnesium. Magnesium itself, it's a mineral. Again, DMSO can take that mineral and drag it right into the tissue and get us the relief. If you have restless legs at night, magnesium will help. If you've got back pain because your back just won't quite release, those muscles won't quite let go, magnesium will help. And getting it into the muscle is where DMSO comes in. Vitamin D3, sometimes we think about D3 for skin, perhaps, because it's from the sunlight that we derive our best source of D3. D3 is critical for a lot of things: mental health, skin health, and joint health. The soft tissue, the connective tissue of joints depends on a good supply of D3. And again, most Americans, most developed countries are deficient in D3 among the adults. So we've added that to some of our formulations to get that into the joints to help. And then finally, I put castor oil. Castor oil is kind of interesting, often overlooked. Castor oil is really good with inflammation by itself, but it penetrates only pretty well. I want it all the way into the joint. So again, apply it with DMSO. And then you get the full benefit of the castor oil. All right, a few more notes about this DMSO, this nature's healer. There are 2 grades of DMSO. If you go online, you're going to find that DMSO is a solvent, an industrial solvent, and it is. Don't get too alarmed. Water itself is the universal solvent. A solvent means that the substance can simply help other solutes be broken down. In this case of DMSO, 2 grades. The industrial grade is really handy for all kinds of things, cleaning products, all sorts of things. But we're not looking for that. We're looking for the pharmaceutical grade DMSO, highly purified, highly filtered. It is 99.995% pure. And that tiny little piece on the end, that's just a little bit of water that we can't get rid of. Tiny, tiny, tiny bit. That's what we're looking for, 99.995% pure to put on our bodies or the bodies of our pets. If you have a dog with an achy joint, DMSO. And we can do that through our products, or you can get the DMSO at a veterinarian supply store. Just make sure it's pharmaceutical grade. Next, the chemical makeup is kind of interesting. The chemical makeup of DMSO, it only has 4 underlying elements: carbon, oxygen, hydrogen, and sulfur. Sulfur is the most interesting part because it's with the sulfur that we get the healing effects that we're after. But we can also get a garlic smell. If you have some liquid DMSO and you leave the lid off, the next morning you're going to observe a couple of things. First, that DMSO is going to be just a little more full. That jar is going to be just a little bit more full because DMSO draws water and binds with it. It'll draw water right out of the air. So you're going to have just a little bit more in that glass container. Also, when water is put into DMSO, it reacts. Creates a little bit of heat, not a problem, but it also gives off a little bit of a garlic smell. That does not mean that the DMSO is somehow defective or bad. It just means you've got a little bit of water in the DMSO. Don't worry about it. If you use one of our products, we start with a nice cream base for some of our products. But over the course of a month, if you're using it, take the lid off. You're putting the cream on in the morning, put the lid back on. Later that night, take the lid off, put it on. What's left in the jar will slowly get a little thinner because as long as that lid is off, you're drawing a little, or it's drawing a little bit of moisture, a little bit of water from the atmosphere. And it just makes the cream a smidgen thinner. It doesn't change the efficacy. It still does the same awesome stuff, but it will get slightly thinner as those water molecules are drawn in. Again, not a problem. By the way, when you store DMSO, DMSO has to be stored in a very particular way. There are only certain kinds of containers that work. We prefer glass, although sometimes we'll use a polypropylene. There are a few types of plastics that work really well for storing of a DMSO or a DMSO containing product. But we prefer glass, a dark glass. We use amber glass for some things and a cobalt blue, beautiful cobalt blue for other things. And that makes sure that we're going to have a container that's not reacting with the DMSO. Very important. As far as using DMSO, DMSO can be used regularly. I use it multiple times per day. It does not build up in the body. It's not like a fat-soluble vitamin that can be overdone. So you can use it daily. That's okay. It can be used internally with some precautions. In that case, you need to get some good guidance from your healthcare professional because it is a potent natural healer. And it will interact with some prescription drugs. In particular, if you're taking diuretics and you're also taking oral DMSO or injectable DMSO, they're not going to be playing well together because DMSO itself is drawing water like a diuretic, as is your diuretic. You don't want that combination. So if you're on prescription medications, especially any dealing with kidney function, talk to your healthcare professional and make sure that everything's going to work well together. Personally, I use DMSO, like I've said, multiple times per day, and it really helps with all my different issues. It does not interact with things that I take. I take supplements, I take vitamins, I take whatever my naturopath is asking me to supplement with. No prescriptions. But if I do, for some reason, need a prescription, maybe for sinuses, I'm going to clear that with my naturopath just to make sure. Anyway, with all that, I encourage you to take a good hard look at DMSO. It is awesome. It needs to be in your family first aid kit. It needs to be part of your daily routine, especially if you deal with pain, inflammation, any of the injury related hassles, or just getting old kind of hassles. You really need to use it. By the way, getting old doesn't mean you have to wait till you're 70 to use the product. We've got a lot of folks that are 30 years old that use the product, and we get tremendous reviews. Anyway, that's all. I hope you enjoyed this and got some benefit from it. Okay.